Good morning, everyone. This is Don Ketterhagen, and I'm with Dr. Debi Strand, who is a prominent dentist with a different approach, and I think you'd find this very interesting. Good morning.
Good morning.
Tell us a little bit about your background and how you ended up in Naples.
I actually am a Minnesota native, and I went to school at the University of Minnesota. After practicing for 2 years in the University of Minnesota healthcare system, I decided to join the United States Navy.
Wow.
So I called them up and asked them, "Do you have any place warm?" And they said Florida, so I took it. Of course, I didn't stay in Florida. I got to move around a little bit being in the military. But when I left the military, I moved back to Florida and took the boards here in Florida and became licensed in the state of Florida as well. I've had a successful practice that I sold back in 2008 and decided that I wanted to live down in this beautiful country called Naples. So
Wonderful.
I moved down here and retired. I take continuing education classes. And a few years ago, I came across this amazing concept called 6 month smiles. And so I decided to come out of retirement and open up a practice exclusively straightening teeth on adults called 6 month smiles.
Well, that's very interesting. Very interesting. So you've already been retired once.
Yes, I have.
Well, tell us a little bit about what you're doing differently now in your practice as compared to your former practice.
Well, my former practice was a machine. Had 4,000 patients. I had three hygienists, two assistants, and I had an associate work with me as well as a few front desk people. So it was a large practice. I moved from room to room. We had a bunch of different operatories, and I loved my patients. I loved what I did, but I did a variety of things as a general dentist. Now, I am a general dentist, but I limit my practice to just doing braces on adults. And I like to let everybody know that's what I am. I am a general dentist. It's just a general dentist can do everything in dentistry, but we just didn't go on to the education, the specialty of being called an orthodontist. So I am a general dentist. Um, the difference here in my office is that I have one chair. Before I had all these rooms, and now I have one chair. The beauty of that is that I cater to the person here. I'm not worried about what's going on in the next room. I'm not worried about being behind because I make sure the time I take is with the person who's here in the room.
That's the way it should be. How would it be if you give us a little tour of your office? Because I know a lot of people are very anxious about going to the dentist, and I saw your office, and it's anything but anxiety provoking.
Thank you. That is one of the first things that I did is when I go someplace, because even though I'm a healthcare provider, I don't like to go to the doctor myself and I get anxious. So when I came in here, I sat down in every area of my office to see how I felt and to see how other people would feel. So actually, I am in my room that I do all my work in, and I'm sitting in a chair that right next door, I've got a second chair. And I want people to sit down right here and talk to me because they're afraid of this chair over here.
That's the one that
Now,
everybody's afraid of.
if you look, I'm going to step back because my office is actually 17 by 17, and I have hardwood floors in here. I don't have anything that's white and sterile. I make it look like a home. And when I set you back in the chair, you get the opportunity to look at that.
Oh, that shows very well. That's
Yeah,
beautiful.
thank you. And it is, if you look, it is all windows. And it's not on the water, which I would love it to be, but I tell people to pretend like it's a canal with boats out there. So that is my office. I live and breathe this. I love it. I love seeing people transform into this beautiful smile, and that's the reason why I did it. I'm not the dentist with needles or telling somebody I have to extract a tooth or anything like this. This is something where I can talk to people and they're I never have to call to confirm an appointment. They're in my chair, they're ready, they're waiting, they want to see their smile be the smile that they deserve to have. So I'm very fortunate.
Tell me a little bit about how you do that. My background is that my father was an orthodontist, and he was president of the Angle Society, and very well thought of in Milwaukee. And being one of his three sons, I had to have perfect teeth. I was his walking advertisement. So I had braces three times, and I do have fairly nice teeth,
You do. Nice.
and no cavities either, I might add. But it was a long process, and I know there's this technique called Invisalign that's been
Hmm.
out for a number of years, and something that you do that's different than that. Can you tell us about that, please?
Yes, what I use is I actually use clear brackets, which are attached through the teeth, which most people would know them as metal brackets, because that's generally what traditional orthodontics is the metal brackets with the metal wire that straightens the teeth. Now I use clear brackets and a tooth colored wire. The wire is a nickel titanium wire. So I tell people it's like a slinky. Remember the slinkies? You could pull them apart and they stretch
Sure.
back in. Well, this nickel titanium wire has an arch shape. Actually, I have one here.
Great.
So I don't know how much you can see of this wire. Let's see. I
Hold
am
up a
not good
little
with this.
higher.
There we go.
Perfect. Perfect.
So you can see I can twist and bend it, and it, does that show it better?
Oh, we see it. Yes.
Okay, good. And it goes back into its arch shape. And you can see, you can hardly see it. So, and the bracket itself is clear. I don't know if you can see that in my hand.
Just just barely. It's
Okay.
small. I'm certain
It's
you can hardly see
very
it when it's
small.
attached to the
Yeah.
teeth.
It's a clear bracket. So now how I can do this and what's a little bit different than a traditional orthodontist. And I tell you, if I cannot do a case, I definitely refer to an orthodontist. Okay. What I do is most people as adults, we're very comfortable with our bite. We just have those crooked front teeth we don't like to show because we're smiling and looking at people all day long. Well, anterior teeth are single rooted. So if I put my feet together, you can push me over pretty easily. Okay.
Right.
Posterior teeth are tripoded. So if I put my feet apart, you can't push me over. We use those posterior teeth to actually use as anchors to help us move those anterior teeth and rotate them around in the smile. So we're not trying to change like a huge midline deviation where your teeth, your center teeth are like off to one side, like Tom Cruise used to have. Okay, we're not doing that. We're just straightening them. Or somebody who has what we call an overjet. An overjet is where the front teeth come way out farther than the bottom teeth. Well, that's really not something that we're going to change a whole lot of. That again would be what a traditional orthodontist does.
That would be what, a class three malocclusion or something?
Yeah, very good. I actually have a pretty interesting case right now where I have what's called an underbite. Where the exactly it's kind of like the dog bite, and I'm changing her bite out, and I can't wait to show that one because she is changing and she is smiling from ear to ear, looking beautiful. So I'm looking forward to that. It
That,
generally takes me um, it's called 6 month smiles. My longest case actually has been 10 months. So sometimes it'll vary from person to person. But I have had a few people who are done in 3 and 4 months too. So it really varies.
that's very very quick. I know my treatment courses were quite a bit longer, but I had teeth that were rotated. I had gaps that needed to be closed, and it was more than just the vertical straightening. So there are some cases that I'm sure just are not appropriate for your technique. Now, I'd never heard of that before. Did I hear you correctly that this is something that you invented?
No, 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 no,
Oh,
no.
okay.
I did not invent this. This has been around for a long time. I stumbled across it doing continuing education courses. And then I went through the training, actually times two, because I really wanted to make sure this was something that I felt comfortable in, that I knew was really something that was going to work. And the results I've seen, and I have testimonials. I actually have people offering to do video testimonials for me because they love the way everything's been changing. But no, it's been around for a while. It's just something. It's kind of like I tell people like the stores. You hear about Walmart all the time, but you never really hear about a Kmart because Kmart doesn't advertise like Walmart does. And that's the same with Invisalign. You hear a lot about it because they do a great job advertising.
Yes.
Now, the reason why I don't do Invisalign is Invisalign, there's a couple of things. Invisalign really doesn't have the quality of rotating the teeth, but the biggest thing with Invisalign is its compliance. If you're not going to wear it, it's not going to work. So by putting actually attaching the brackets and the wires to the teeth, it's there. You can't take it off. It moves and does everything for you, and you don't have to think about it.
So Invisalign is more like a retainer that is changed. Is that the idea?
Exactly. It's different steps of a bunch of different retainers that you put in and slowly wait for your teeth to move. Um, some people can have an Invisalign work for a year, but generally they say again about 2 years for Invisalign to work. And with the traditional orthodontics, the way it used to be is that they used to say that you take out first premolar. So you generally took out 4 teeth when you used to do traditional orthodontics at one time. I don't know if they do it as much, but even when I was practicing, we used to always say, go get your first premolars taken out, and then they're going to move all those teeth back into that spot to form the proper occlusion and the proper bite for the teenagers.
Well, I'm sure it's individualized because the only extractions I had were wisdom teeth.
Exactly. And it varies from no two people are exactly alike with any type of treatment. But that used to be a traditional thing where I used to live is they'd generally take out 4 teeth and straighten things.
Very interesting. What are some of the other interesting things that are new in dentistry? I know from some of my reading that the uh, thought has to do that heart disease and dental and gingivitis are very closely related. How does that all work?
Absolutely. When you think of the mouth, it has so much bacteria inside of it. Now, it's normal bacteria, and everybody varies from what kind of bacteria and how much they have as well. But bacteria is what causes infections. So if you have periodontal disease, which is also called, gum disease, it accumulates that bacteria and the gum tissue swells and there's like a pocket it forms. So that bacteria is there, it causes your gums to bleed. Now, if your gums are bleeding and we're cleaning your teeth, that can go through the blood system and affect the heart. So we really do have a correlation of heart disease and periodontitis. It is something where it's very important health wise to keep your teeth clean. And that's another reason why braces are good
Right.
because you have a smooth surface with straight teeth is going to be easier to clean than the rotated teeth. They have the little nooks and crannies that are very difficult to get into.
Are you a flosser or a water picker?
I personally prefer to floss, but I tell you what, I have seen amazing results with water picks. So I hate to say that water picks are terrible because I used to be a hygienist, but
Oh,
I have
really?
seen. Yes, I actually worked my way up the ranks, as a lot of people say. I worked front desk, I assisted, I was a hygienist, and then became a dentist. So I've been in every aspect of dentistry. But so I didn't like the water picks, but now I've seen the results, and especially with braces, it's nice for the water pick to try to help, our clients keep their teeth clean.
Sure, sure. Do um, clients using your technique, do their teeth hurt when they're under treatment?
People have variances of pain. So I've had some people say it didn't hurt them at all. And I've had other people say, wow, the first few days, they were taking Advil and Tylenol. So it varies from person to person. Generally, within a week, you're feeling comfortable. And I like to explain it as walking on the hot sandy beach during the summertime. When we first go out there with our winter feet and it's hot and it hurts our feet when we first step on it, that's kind of the way it is with our gum tissue until they get used to the brackets. That tissue is very tender and then it toughens up once it's had the braces on.
What can you advise people who are watching this video and are afraid of the dentist to do?
Uh, I know that the internet is amazing, so you can look things up. You can come visit my website. I've got a couple of testimonials. come into my office for a free consultation.
I'm going to
Um,
put that website on the bottom of this video, so and your telephone number so folks can do that. That's great.
Thank you. The biggest thing is the fear of the unknown. And I like to make people feel comfortable. And even if I cannot provide the services for you, I'd like to let you know what is out there and what can be done. And like I said, if it's a complicated case, I definitely refer to the orthodontist. Um, I also like to make sure that your gum tissue is nice and healthy, that we have the proper x rays, and to make sure that it's what you want. Because that's my biggest thing. What are you looking for? What is your chief complaint? And that's what I want to take care of.
That's very interesting. Well, I want to thank you for your time. I think this is very informative. I think it'll be very helpful for those folks that are wanting to know more about dental care and what else is out there. And you certainly have an innovative way of accomplishing what used to be a long and painful process, at least for me it was.
Yes.
And your background is totally awesome. I know what I wanted to ask. Do you have dentistry in your family?
No,
That's
I am
really, and how did you
actually,
get interested in this?
uh, I am the first one in my family with a college education.
Really?
And yes, I came from an extremely poor family. And so I originally wanted to become a physician, but I couldn't dissect a frog to save my life. I did not like, I cry at everything. And so I decided that dentistry was still a great way of helping people without telling them that they were going to lose a limb or a life. So um, it was an interesting concept, and I think that's why I started out working my way up the rank, is because I wanted to make sure that I really loved what I was doing. And then I used to think, well, if I never made it to dental school, I could always stay a hygienist because it still kept me in the field of dentistry. So that's kind of the way I did it.
And with that, I'm going to end the interview, and I want to thank you for your time. It's really a very interesting interview, and I'm sure you're going to have lots of comments on it. So, Dr. Debbie Strand, thank you again for your time, and we'll make this a wrap.
Great. Thank you very much.
You're
Have a great
welcome.
day.
You too. Bye bye now.